The Trump administration's overhaul of U.S. vaccine policy is escalating. In the last few months, a string of federal decisions have rewritten the list of shots that children should get.
Well, the CDC has adopted new guidance for hepatitis B vaccines for babies. The
agency no longer recommending the COVID vaccine for everyone.
Further reducing the number of vaccines it previously recommended for children from 17 to 11.
Those big federal shifts are now playing out across states, where most vaccine policy actually gets put into practice. As of February, at least half of U.S. states have rejected new federal guidance on vaccines for kids.
It's just changed from a process that was very routinized and predictable to one that has become really quite chaotic.
Today, we explain how the federal-state partnership on childhood vaccines broke down and what happens to our public health when vaccine policy gets messy. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. To help us make sense of this rift between states and the federal government over vaccines, I'm joined by Tradeoffs reporter Melanie Evans, who's been following this since the early days of the Trump administration. Hi, Melanie.
Hey, Dan.
So, Melanie, to start, I would think it'd be really helpful to establish just a few basics about what vaccine policy typically looks like between the states and the feds. Who's in charge of what? What does the federal government control? What power do states have? Things like that.
Well, Dan, the feds decide whether a vaccine is safe and effective enough to be publicly released. Then the federal CDC, the Centers for Disease Control and Prevention, issues a list of recommended vaccines with help from a group of scientific advisors. But these are recommendations. States are the only ones who can require or mandate that someone get a vaccine.
Historically, states have put a lot of weight, though, in those federal recommendations, right, Melanie?
Right. For decades, the feds have brought together scientists, major medical groups, doctors, nurses to track the latest science and evaluate the risk and benefit of vaccines. States trusted this very rigorous, very public process, and they relied on federal recommendations to make a whole bunch of decisions, including which vaccines kids need to go to school.
Okay, so bottom line, the feds lack the authority to mandate these vaccines, but they have had a huge influence on state policy.
Exactly. This whole arrangement is in many ways unofficial. States are free to do what they want, but since the mid-90s, they've followed the federal guidance, and it's in effect created something like a national standard. For example, nearly every state requires at least 9 recommended shots for children entering school, including measles, polio, and whooping cough. And that is a big reason we see so few of these diseases. There's been a clear, consistent answer for policymakers, parents, and doctors about how to vaccinate kids.
Got it. Thanks, Melanie. That overview is really helpful. So let's get into what is going on now. What's happening to this de facto national vaccine standard?
To put it simply, Dan, it's gone. A bunch of states have stopped looking to the feds for guidance on which vaccines kids should get. No more clear, consistent answer from a single trusted source. This breakdown in trust in the CDC began during the pandemic, when a lot of Republicans started losing faith in the agency. Then Democrats started losing confidence after Robert F. Kennedy Jr. took over as health secretary.
Sure, Kennedy's a longtime vaccine skeptic, and he's been busy making lots of changes to U.S. vaccine policy in just the last year. Melanie, what specific moves has Kennedy made that have really widened this rift with states?
So a big one was firing the head of the CDC last August.
Tonight, we've learned Dr. Susan Menars has been fired just weeks after she was nominated and confirmed by the U.S. Senate.
Been fired because she didn't align with the president's Make America Healthy Again agenda.
The CDC director, Susan Menars, said she was pushed out over vaccine policy.
I remember this. Several CDC leaders also resigned.
Right. And all of this really rattled governors in Western states, who threw their health staff into a marathon meeting over a holiday weekend.
It was very, very clear that CDC leadership was compromised.
Health Officer Tao Sheng Kwan-Gett from Washington and his counterparts in California and Oregon hashed out a strategy to respond to possible federal vaccine changes.
With the departure of these highly respected public health leaders at CDC, we can no longer rely on them to make decisions and public health recommendations based on the best available science.
The 3 states soon announced they'd follow major medical groups' guidance for vaccines Americans typically get each fall. Around the same time, Dan, RFK Jr.'s hand-picked CDC advisors announced their new recommendations for the COVID vaccine. Rather than encouraging everyone over the age of 6 months to get the shots, the Kennedy advisors said people should talk to their doctors because the risks could outweigh the benefits.
A break from scientific consensus, right?
Right. Medical societies representing pediatricians, family physicians, OBGYNs, they all said the decision was out of line with the evidence. Some states rejected the COVID guidance, but a few went further, saying they would no longer rely on the CDC for any recommendations.
The idea that states would publicly announce that they were departing from federal guidelines on vaccine recommendations just hasn't happened.
Jen Cates tracks vaccine policy at the health research group KFF. Jen says this crack in the national standard really blew open over the winter as the feds weakened recommendations around a bunch of childhood vaccines. For example, instead of saying kids should definitely get vaccinated against hepatitis B and flu, the CDC again said parents should consider it in conversation with doctors. The agency defended the move, arguing its new recommendations are now closer to other developed nations. Jen said many states weren't buying it.
That prompted a bunch more states to come on and say, we're not going to follow that.
Jen watched even more states defect from the federal standards as the changes piled up. By January, states that had split with the feds on the entire childhood vaccine schedule jumped to 25, plus a few more that rejected some of the new guidance.
It's quite a big departure. I'm not aware of that kind of phenomenon happening before, and certainly not at this scale.
And Melanie, were these all Democratic states or a mix of red and blue?
Most have Democratic governors, but a few are Republican, like Vermont and New Hampshire.
So in the course of just a few months, we've gone from pretty much all states and the federal government working off the same vaccine playbook to this huge split?
That's right. I reached out to the CDC about this. A spokeswoman told me federal health agencies will work with states and clinicians to get families information they need to, quote, make their own informed decisions. But states that split from the CDC are really worried this new federal guidance has instead made this much harder. States are now trying to adjust their policies, and truthfully, Dan, it's a bit messy.
When we come back, Melanie explains what this rupture will mean for how people get vaccines and the risk of future outbreaks. Welcome back. Today we're talking about the growing rift between states and the federal government on children's vaccines. In the last 6 months, the Trump administration made several controversial changes to federal guidance on which shots kids should get. Half of states rejected those changes. So now the nation has competing recommendations for kids' vaccines. To help us understand what this means at a practical level, we asked Tradeoffs reporter Melanie Evans to interview policymakers, epidemiologists, and doctors. So, Melanie, half of the states have split from federal vaccine guidelines. That sounds like a big deal. My question is whether this will actually make a difference in who gets which vaccines.
The short answer to that, Dan, is yes. Here's one reason why. A big job of state health departments is to decide which vaccines to promote to parents and doctors. That's a lot harder to do when you have more than one list of recommended vaccines. That's what pediatrician Michelle Fiscus told me. Michelle is the chief medical officer for the Association of Immunization Managers.
It's just changed from a process that was very routinized and predictable to one that has become really quite chaotic, where clinicians are having to question whether or not the recommendations they're making are being made based on the best available evidence or not.
Michelle says all this shifting guidance, this chaos, could have real consequences. She used the flu vaccine as an example. The CDC in January said parents should talk with their children's doctor about whether they need the flu vaccine. That's a split from medical groups who continue to endorse the annual shots.
We have never gotten flu immunization to the levels that we need to, and now it's going to be harder for clinicians to feel like they can make the same confident recommendation that they made 3 months ago about getting a flu vaccine. And that's going to amount to more illness, more hospitalizations, more unnecessary deaths.
All around the country, Dan, lots of public health folks at the state level are really worried about this loss of a national standard. A handful of states have decided the best way to minimize confusion for the public is to partner up. Washington, California, Oregon, Hawaii, they've all agreed to follow the same guidance from the American Academy of Pediatrics. In the Northeast, at least 7 states have also teamed up.
So not a national standard, but a regional one.
Exactly. By banding together, the states hope to give a clear, consistent answer to doctors and parents who might be a little lost or frustrated with all the changes.
Okay, so the conflicting recommendations are going to make vaccine decisions more difficult for parents and doctors. Another question I have, Melanie, is whether this rift is going to change which shots kids are required to get.
Remember, mandates have always been set by the states. So in states that have broken with the CDC, vaccine requirements will likely stay the same, but states may need to change laws to make that happen.
And what about the rest of the states?
Well, there are a few that are using this moment to try to get rid of mandates entirely.
All of them. All of them. Every last one of them.
That's Florida's Surgeon General Joseph Ladapo last September, making an argument that's shared by many who oppose mandates.
Who am I as a government, or anyone else, or who am I as a man standing here now to tell you what you should put in your body?
Ladapo is moving ahead with removing mandates for some shots. Idaho last year prohibited all school mandates. For now, these states are outliers. We will have to wait and see what happens to mandates in the rest of the states that stick with CDC guidance. But after decades of vaccine policy being designed to get more people vaccinated, we are now seeing real momentum and powerful support, including from the nation's health secretary, for policies that prioritize letting people opt out.
And Melanie, what about money? A lot of the cost of these vaccines are picked up by either insurers or the federal government.
That's right, Dan. Federal law requires almost all insurers to cover the CDC-recommended vaccines at no cost to patients. Nothing. When it comes to low-income kids, the feds actually pick up the tab, and last year they shelled out nearly $8 billion. So far, nothing much has really changed here. But states are worried it could, so many of them are working on contingencies to make sure that vaccines stay free for as many people as possible. For their part, insurance companies have promised to keep covering all vaccines through at least the end of 2026.
So this has the potential to be quite disruptive, it sounds like, and expensive for states and patients, but it hasn't yet.
That's right.
So where does this leave us, Melanie? We know with fewer people vaccinated, we see more infections. As states strike out on their own here, is there anything to be gained? Like, is there an upside? Is there an argument that states can be more responsive to local needs, laboratories to test new ideas?
Sure, Dan, this is a valid argument for a lot of policy. But here's where lawyers and scientists and doctors that I spoke with say it falls short for vaccines. We know what works.
Vaccines are victims of their own success.
That's Dorit Reiss. She's a public health law professor at the University of California, San Francisco. So many of us have grown up without the threat of infection, she said, without the fear and the consequences of outbreaks. And that's because vaccines are incredibly effective.
I think we're going to learn why we need to worry about these diseases Of course, the problem with this kind of learning is the cost. It comes in people's life and health, and that's horrible, and we don't want that.
The thing is, Dan, we've been through this before. In the 1960s and 70s, as new vaccines emerged, each state came up with their own policies. They were all over the map. I talked with one person who was there, who investigated what is a really textbook example of what happens when states have different vaccine policies. Philip Landrigan landed in Texarkana in the fall of 1970. That city is split between Texas and Arkansas, and hundreds of kids there had come down with measles.
95% of the cases were on the Texas side, and only 5% of the cases of measles were on the Arkansas side of the state line.
Arkansas, Philip learned, required students to get the measles vaccine and ran campaigns to immunize kids.
Texas, on the other hand, was all about free enterprise.
No vaccine requirement in Texas, no go get vaccinated campaign, and parents had to pay if they wanted their kid to get a measles shot. In the fight to get every state to adopt vaccine mandates, lots of public health people used Texarkana as this case study for their effectiveness. It took about a decade from the Texarkana outbreak for all states to require vaccines. During that time, the U.S. averaged about 35,000 measles cases a year. Hundreds of people died. The lesson here is clear. Policy matters. Arkansas kept kids protected with its strategy. That's good news for the states sticking with mandates and medical society recommendations.
Those policies can save lives, but Melanie, at the same time, it's also true Arkansas residents were at risk from the outbreak across the border, and some got sick. The reality is there's only so much each state can do on its own.
Exactly, Dan. And that's what scares Philip.
We're going to see more Texarkanas, so long as there are other states where large numbers of children are unvaccinated. Those states represent a threat. More children are going to get measles, more children are going to get rubella. Some children could get polio. All of that can be prevented.
Thank you so much for your reporting on this, Melanie.
You're welcome.
I'm Dan Gorenstein. This is Tradeoffs. Immigration enforcement is posing twin threats to healthcare. First, patients are afraid to show up to medical appointments. Second, threats to healthcare workers themselves. Doctors, nurses, home health aides are being detained, deported, or losing their visa status.
The number of moments I've had where I feel overcome just with anger, because all we're trying to do is give healthcare to people.
What happens to healthcare when immigrants become federal targets? That's next time on Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us. The NPR app, Apple Podcasts, Spotify, wherever. The Tradeoffs team is producers Melanie Evans and Julie Werno, senior producer Leslie Walker, managing editor Ryan Levy, marketing director of partnerships and growth Eleanor Kutzi, marketing director Catherine Dougal, sound designer Andrew Perella, chief operations officer Colleen Scheck, with help from Kate Seepy, Cedric Wilson, and Haley Lerner. The executive editor is Dan Gorenstein. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Special thanks this week to Leslie Francis, Richard Hughes IV, Walter Ornstein, Adam Ratner, and Jason Schwartz. Thanks also to all our listeners who help to support our work, including Louise Griffith, Cheryl Blaschuk, Cecilia Oregon, Berna Hebner, Kenneth McConnell, and Esther Lontheis. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Foundation for Opioid Response Efforts, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.